Focusing on Maharashtra, which continues to be the worst hit state in the country as it recorded over 15,000 new COVID cases in the last 24 hours alone. On Friday, the state recorded 15,817 new cases, with the positivity rate going up to 16.26%. Mumbai has recorded over 1,600 new cases. Over the past several days now, Maharashtra has been recording more than 50% of the total daily COVID case rise in the country. Amid the surge, Maharashtra Chief Secretary held a COVID review meeting yesterday in which the Chief Secretary directed collectors to increase COVID testing and implement containment policy aggressively where positivity rate is higher. Vaccinations will also be increased in districts where positivity rate is high. Further, strict action will be taken against COVID violators. Let me go across to my colleague Mayuresh. Mayuresh, so what we have in fact seen is that certain measures have in fact already been announced by the Chief Secretary in the meeting yesterday. We have seen different district collectors also, the Chief Minister's already allowed them to take steps as necessary in their areas. But the surge continues with every day in fact being the highest that the state has seen over the past couple of days as a daily case rise.
Absolutely, Tanima. And the 15,000 number, first time after almost 3 to 4 months, the Maharashtra has crossed. And they have reported 15,000 cases, and which is cause of concern. And that's why we saw that Maharashtra Chief Secretary held a meeting with all the district collectors as well as divisional commissioners. And in that meeting, he had given a strict orders to all the collectors to increase the testing in their area, increase the testing in their district. Because if you remember that it was center team who also said that Maharashtra is not testing or is not conducting the test as per the protocol, or they are not conducting enough tests, and that's why the numbers are rising. So that's why the Chief Secretary has said to increase the testing in all the districts. He has also said about the vaccination, that the vaccination should be increased. He further said the districts which are basically showing more cases or reporting more cases, or the positivity rate is more, the state government will help them to get more vaccine, but they have to increase the vaccination. For that, the primary healthcare centers in all the districts should be used. So yes, the cases are rising in Maharashtra. Maharashtra is contributing as compared to other states more in the COVID cases, and we can see that the 15,000 cases have been recorded in past 24 hours. Even if we talk about Mumbai alone recorded 1,600 cases in last 24 hours.
Right, Mayuresh. In fact, what we have in fact seen even in Pune, the positivity rate has gone up by, it has jumped up from 15% to 22% in one single day. So Pune is also one of the concern areas.
Absolutely, and that's why, if you remember, there is already a kind of a night curfew in the place in Pune, that post 11 p.m. people are not allowed to go out of their houses. Even they are not allowed to roam on the streets. Only essential services have been allowed to work. Also, Tanima, just to give update to our viewers that from today, Parbhani district is going in a complete lockdown till Monday, that is till 15th of March. Only essential services will be allowed in Parbhani district.
So much for joining us with all those details. Meanwhile, Mirror Now spoke to Health Minister of the state, Rajesh Tope, amid surge in COVID cases. The Health Minister blamed the laxity of common people for the surge. He further denied that the government has failed to curb the surge and emphasized that COVID-appropriate behavior is the only solution to curb the rise.
So firstly, we are looking at, semi-lockdown, and in few districts, lockdown, particularly due to rise in the cases. But why we are looking at this lockdown after a year? Is it because the government did really fail to implement the existing lockdown rules, for that matter, as far as the entire situation is concerned? Because after a year, we are looking at lockdown. Do you think it is also because hampering the economy at large?
Absolutely not, because last 2-3 months, if you would have observed closely, we had actually flattened the curve. The numbers were not increasing more than 2,500 and more, and so it was absolutely flattening of curve. Only thing is that again it is a second surge which is coming up, and we have to see that wherever there are rules and regulations being not followed in that particular districts or in city, we have to intervene and have some other options. Yes, we have to open up the economy as well. We have to see to the economy as well, because we cannot always keep a lot of restrictions on people. So once the government has decided now to open up, in that case, yes, there was some lethargy in people also. It's not like 100% there was nothing lethargy like it. It was like a chalta hai type attitude of the people. So that also is one of the reason. I think COVID appropriate behavior is the only solution which we are looking after, and we are trying to execute it or implement it very strictly.
So lockdown is expected in Maharashtra?
Not at all. Not at all.
Not at all?
Not at all.
Meanwhile, in Maharashtra's Palghar, 79 people, including students, teachers and staff of 3 residential schools, have tested COVID positive. All of them were tested in last 1 week alone. Students with mild symptoms have been hospitalized, while others have been isolated. And shifting tracks to another state now, which has also been seeing a surge, Tamil Nadu recorded 670 new COVID cases in the last 24 hours. Taking a serious note of the rising COVID trend, the administration has started to fine COVID violators now. Majority of the cases are in fact being reported from Chennai, and the health department has attributed the rise in cases to non-compliance of COVID guidelines. Let me go across to my colleague Mugilan. Mugilan, what we can in fact see in terms of Tamil Nadu, the situation is a little different. It is a poll-bound state. There are going to be lots of gatherings with regard to elections. People are going to come out. There will be campaigning as well. What we have in fact seen is that this case rise is primarily in Chennai. Like Chennai is reporting most of the new cases, fresh cases. But what exactly are the authorities doing? How are they going to control the situation in a state which is heading for the elections?
Definitely, in last 15 days, we are seeing a gradual increase, a gradual uptrend in the number of fresh positive cases that have been reported on daily basis, because now it has once again started, it has crossed more than 600 cases a day. In last 3 days, we are seeing the number of positive cases are being registered more than 600. So this has come as a very big worrying factor for the Tamil Nadu Health Department. Last week, we have seen in Chennai also there was a sharp rise in the number of positive cases. So now the Health Department have once again started to expedite their awareness work, and now the Health Department have started penalizing the people who fail to use face mask in the public places. And more importantly, in Chennai alone, so far, that is until March 10th, the Chennai Corporation alone have collected close to 3.36 crores as a fine from individuals and several organizations and commercial places for not following the COVID guidelines that have been given by the Tamil Nadu Health Department. When we spoke with the Health Secretary, he said that the people, as the numbers have come down, the people have stopped following the guidelines that have been issued by the Tamil Nadu state government. And as you rightly said, as the election season also is now nearing, the health department is particularly worried about the large gathering of people in public places. Yesterday, as soon as the candidate list was announced by all the political parties, we have seen the political leaders have started the election campaigning. Even yesterday, when Chief Minister was in Salem during an election campaign, we have seen that there have been violation of people not wearing face masks during the public rallies. Now, Health Department is completely worried about the election season and the pre-assembling of people ahead of the public rallies also. But in Tamil Nadu, the numbers have started picking up. In last 15 days alone, there has been a rise by 50% is what we getting to hear from the Health Department. And Health Department now time and again instructing people to follow all the guidelines that have been issued by the Health Department and vaccinate if they belongs to a priority group that's announced by the central government.
Right, Mugilan, thank you so much for joining us with that update. And another city, in fact, or a state, union territory for this matter, in fact, which is seeing a surge is the national capital, which witnessed over 400 new COVID cases for the second consecutive day this month. At 431 cases, Delhi recorded the highest single-day spike in over 2 months. The national capital has been reporting a surge in infections for more than a week now. But the Delhi Health Minister, Satyendra Jain, has said that there's no need to worry as the government is on alert.
पिछले 2 महीने से लगातार 1% से नीचे है, अभी भी वेल बिलो 1% है। आज का हेल्थ बुलेटिन थोड़ी देर में आपको आ जाएगा। उसके अंदर हमने 90,000 से भी ज़्यादा टेस्ट किए हैं और पॉजिटिविटी 0.3% आ रही है। तो ये फ्लक्चुएशन जो 0.3, 0.4, 0.5 इसको इतना मुझे लगता है इतना फ़र्क नहीं पड़ता है। 1% से नीचे है। अगर 1% को जैसे WHO कह रहा था 5% से नीचे रहनी चाहिए, तो 5% से नहीं 1% से नीचे और पिछले 2 महीने से लगातार 1% से नीचे और 1% को अभी तक उसके आसपास भी नहीं पहुंची है।
Meanwhile, the World Health Organization's Expert Advisory Committee is now looking into the issue of a few countries pausing distribution of AstraZeneca COVID vaccine. However, the WHO spokesperson also added that there was no reason not to use it. Health authorities in at least 6 European nations have temporarily suspended the use of AstraZeneca vaccine after some isolated reports of blood clot formation in some people. WHO spokesperson said that it's an excellent vaccine and that no causal relationship has been established between AstraZeneca vaccine and any health issues. The WHO termed the country's move as a precautionary measure.